Greetings to everyone. This is Malar Kuppan, the Doctor of Nursing Practice student at Maryville University, is doing this presentation on the DNP project. The project topic is on adult transgender population's mental health, minimizing the barrier to access psychiatric care. I would like to acknowledge and thank the faculty chairperson, Dr. Tanya Crystal at Maryville University, all the faculty at Maryville University, including Dr. Snell and all the course instructors, and the committee member, Crystal Donnelly, the psychiatric nurse practitioner, for all their continued support and constructive feedback throughout this DNP course and implementing this project and completing the DNP course successfully. When looking at the purpose, let's see what was the purpose in conducting this DNP project. The purpose was to determine if providing a telehealth option intervention for the adult transgender population having a barrier to access the psychiatric care for their mental health would increase the number of visits the patient had with the provider compared to in-person visits alone. When discussing the background for conducting this DNP project, there are approximately 1.4 million, that is 0.6% of the US adults identified themselves as transgenders. These transgender individuals encounter significant barriers to accessing healthcare, gender-affirming quality therapeutic interventions, and primary care. These access to care barriers results in increased mental health conditions and increased healthcare expenditure for the nation. Studies support that telehealth option intervention can minimize the access barrier in this adult transgender population. Now we are going to see how the review of literature supported conducting this DNP project. 13 peer-reviewed research articles were reviewed and utilized for this project. The review provided a clear understanding of barriers to accessing psychiatric care in the adult transgender population and also improving access to psychiatric care. It also provided a strong foundation for implementing the telehealth option intervention for this project and also provided promising results for the access to psychiatric care in the adult transgender populations with an intervention of telehealth option as the best practice. Let's see what kind of theoretical framework was utilized to guide this DNP project and how it impacted the formation of work. The theoretical framework that was utilized for this DNP project was Levin's change theory, otherwise called as Levin's force field analysis. This classic theory really fits very well into this DNP project of minimizing the barriers to access care and maximizing the access to psychiatric care in the adult transgender population. This Levin's change theory has three phases. The first phase is unfreezing phase, the second one is changing or moving phase, and the third one is the refreezing phase. During the unfreezing phase, the individual or the individuals will let go of the current equilibrium of the barrier. During the changing or moving phase, they will be looking for alternatives. And during the refreezing phase, they must celebrate the success of the alternatives they sought and will sustain the change they made through the alternatives. In this adult transgender population, during the unfreezing phase, the adult transgender populations let go of the current equilibrium of the barrier in seeking the mental health care. During the changing or moving phase, they sought the alternatives of using telehealth option and utilized it. During the refreezing phase, they celebrated the success of seeking mental health care through telehealth visits, and they sustained the change themselves by making increased number of telehealth visits with the provider. When looking at the research methods and design, let's see what type of research methods and designs were utilized to carry out this DNP project and why these were selected and how These methods and designs lended themselves to answering the question of inquiry. When discussing about the setting, a private mental health clinic in the United States Southwest region was utilized for this project. When we discuss about the participants, they were a random sample of 54 adult transgender patients from the electronic medical records review with age 18 and older and with the diagnosis of gender dysphoria or sexual identity disorder. The pre-intervention period included July 3rd, 2022 and August 27, 2022, and it included 27 adult transgender patients. The telehealth intervention was implemented on August 28, 2022. The post-intervention period was between August 28, 2022 and October 23, 2022. It also included 27 adult transgender patients. When continuing to discuss about the methods and design utilized for this project, the design utilized was the quantitative explorative design through the retrospective chart review after obtaining the institutional review board approval on the project site. The retrospective chart review was done to collect data from the electronic medical records since the participants were not engaged. Inclusion-exclusion criteria were reviewed, pre-intervention data done on August 28, 2022, the post-intervention data until October 23, 2022 and began on October 24, 2022. The quantitative explorative design was done to help determine the impact of the intervention by counting the number of the visits the patient had with the provider post-intervention. When discussing about the data collection instrument, there was no data collection instrument utilized except the data collection sheet, which was created utilizing the extensive literature review. When we discuss about the resources, the mental health clinic, facility staff, 3 of the psychiatric mental health nurse practitioners, 7 of the mental health counselors and therapists, and office supplies and materials were utilized for this project. When we discuss about the timeline, it included 11 months from designing the study to results, including writing all the chapters. When discussing about the protection of human subjects, there were no risks to the project participants. All identifiers were removed during the data collection and the minimum necessary de-identified data were collected to achieve the project's goal. When describing the sample using descriptive statistics, the data collected from random sample of 54 adult transgender patients from the electronic medical reviews, including 27 pre-intervention and 27 post-intervention adult transgender patients, were coded as a nominal data in the data collection sheet, but the collected data was discrete and ordinal data. Under the descriptive statistics, the median was utilized to compare the pre- and post-intervention data. Why median was utilized? Median more accurately represents the center of the distribution in discrete data. That's why median was utilized. And also the quantitative explorative method was utilized, as we discussed and mentioned earlier, to determine the impact of the telehealth option intervention through the number of the visits the adult transgender population had with the provider after the implementation of the telehealth intervention. Let us see what type of statistical tests were utilized in this DNP project and why these were selected. The data gathered from the electronic medical reviews were analyzed utilizing the SPSS statistical software. Under the guidance of Medieval University statistician Mr. Mark Pauls, the Wilcoxon-Sign-Rank test under the non-parametric test was utilized to evaluate the statistical significance of the intervention, comparing the pre-intervention and post-intervention period. And let's see why these tests were selected. The non-parametric tests were selected because the collected data were discrete and ordinal data. What does it mean by discrete data? The collected data was barely skewed and did not have a normal distribution. Why the Wilcoxon-Sign-Rank test or the Wilcoxon matched pair test with a z-score were utilized? Because the collected data was a pair data, that is the pre and post intervention data, and also it was the discrete data The Wilcoxon sign rank test measures the distribution of differences in central tendencies in discrete data through median. And moreover, what are the criteria to choose the Wilcoxon sign rank test? The data set must include 5 pairs and it must not be more than 30 pairs. And the collected data set in this project was 27 pairs. And the Wilcoxon sign rank test also helped to determine the statistical significance of the intervention by comparing the pre and post-intervention telehealth and in-person visits after the telehealth option intervention implementation. What is Z-score statistics? The Z-score is the rank mean of one group compared to the overall rank mean. Let us look at the data analysis. The analyzed data of the descriptive statistics under the N4 test is shown on this table. The table shows the number of the adult transgender individuals participated in this DNP project before the implementation of the telehealth visits and after the implementation of the telehealth visits and their visits through in-person and post-in-person. And the data table also shows the minimum and maximum number of visits with each time they made with the provider. And it also shows the 58th percentile median visits for the post-intervention telehealth visit as 2 comparing to the post-intervention in-person visits 0.00 and the pre-intervention telehealth visits median 1.00. When we really look at the graph at the bottom, it shows the comparison of visits for each time, that is the in-person and telehealth visits before and after the intervention of the telehealth option. 1A represents the pre-intervention in-person visit, 1B represents the post-intervention in-person visits, and 2A represents the pre-intervention telehealth visits, and 2B represents the post-intervention telehealth visits. And we can clearly see the differences of the post-intervention telehealth visits comparing to the pre-intervention telehealth visits and post-intervention in-person visits in this graph. Look at this analyzed data. This data table shows the ranks of the Wilcoxon sign rank test, and it shows the mean rank of one group compared to the sum of the ranks of the overall group. And when you look at this post-intervention telehealth visits comparing to the post-in-person telehealth visits, the mean rank and the sum of the ranks are shown here. And the same way with the post-intervention telehealth visits compared to the pre-intervention telehealth visits, the mean ranks compared to the sum of the ranks also shown here. Let us look at this analyzed data. This data table shows the test statistics of the Wilcoxon sign rank test, the Z-score value and the two-tailed test values are shown in here in this table. And we can see the post-intervention telehealth visits comparing to the post-in-person visit Z value as 3.797 equal to the p-value less than 0.001. And we also can note the post-intervention telehealth visits comparing to the pre-intervention telehealth visit Z-score at 3.455 and the p-value less than 0.001 in here. Let's discuss the results of this DNP project from the data analysis. When discussing the results utilizing descriptive statistics by using the quantitative method and median, the post-intervention telehealth visits at the 50th percentile median was 2 compared to the in-person visits median 0.00 and the pre-intervention telehealth visits median 1.00. When discussing the statistical significance of the intervention utilizing the Wilcoxon sign rank test, it indicates the improvement was statistically significant for post-intervention telehealth visits compared to post-intervention in-person visits at T23 Z value 3.797 and the p-value less than 0.001. And post-intervention telehealth visits compared to pre-intervention telehealth visits at T.00 Z value 3.455 and the p-value less than 0.001. When discussing about the limitations, let's see what were the limitations that were found in this project that might have affected the results. The first one is the length of the data collection. That was only about 8 weeks and the accessible sample size was small, although enough for providing evidence with the results. And the next one was the generalizability due to the small sample size. Let us discuss about the results of the project findings. The project findings show that telehealth option was an effective intervention to minimize the access barrier to psychiatric care in the adult transgender population. This evidence-based practice intervention also maximized the access and potentially affected the outcomes and safety. And moreover, this evidence-based practice intervention was implemented where there was no promotion of telehealth option intervention for the adult transgender population previously. When discussing about the weaknesses were similar to limitations. And these limitations were discussed earlier during the presentation of this project. Let us see what implications were drawn from this project findings for practice, for safety and quality, and for future research. Let's discuss about the implications drawn for the practice first. We must use the telehealth option as a new effective intervention to minimize the access barrier in the adult transgender population. We also must promote this telehealth service or intervention at the mental health clinic and other healthcare settings. When we discuss about the implications for safety and quality, we must involve patients, healthcare professionals, and the community in adult transgender population's mental health. And we also must develop community programs to create awareness of telehealth services utilization. And the last, we also must address and provide social determinants of health to the adult transgender populations which adversely affect their mental health and the outcomes. When continuing to discuss about implications for future research, further and future studies must focus on promoting telehealth option to minimize access barrier, maximize access, and improve safety and outcomes. The studies also must focus on addressing and advocating for healthcare policies to focus on social determinants of health in this adult transgender population. When looking at the conclusions, let's see what conclusions were drawn from this project findings. The Wilcoxon test indicates the improvement was statistically significant for post-intervention telehealth visits compared to post-intervention in-person visits. This shows sufficient evidence that telehealth services have increased the visits in the adult transgender population and can minimize the access barrier to psychiatric care. Since the test result was statistically significant for post-intervention telehealth visits and the intervention of the telehealth option have increased the visits in the adult transgender population, the project author would not have done anything differently. However, the project author has planned to do future studies in this population with a larger sample size with a longer duration to see the impact of the results and the generalizability of the findings. And also, the project author planned to participate in policy changes and advocate for this underserved population's mental health by participating and being a member in the professional organizations or association. The project author also planned to teaching the student NPs and nurses to understand the mental health in this population and overall for all to improve the safety and outcomes. The project author also believed the DNP program has given and strengthened the hope in participating future researches on this population focused mental health and the mental health of overall population, and also take the lead role in clinical practice, policy changes, and education in future. Feedback or concerns regarding any clarification will be helpful to get deeper insight on this project with its outcome. These are the references that were utilized for this DNP project presentation. Thank you for watching this presentation. I'm looking forward for the feedback.